Hello everyone. Today once again we are meeting. Today is the third session, and as I already told you, we'll be discussing two stations each week. That's on so Monday and Thursday. So today I'm talking. I have taken two stations from the maternal medicine, and maternal medicine is all the topics are all the modules are important. Maternal medicine is a lengthy station. It takes some time, so you need to know how to present in the 10 minutes what is given, and I'll explain to you. So I'll be, as when I explain my station, I already told you it will not be in 10 minutes, it will be more than that. But I would like to tell you, give an introduction about the maternal medicine module. Then so then I will move on to the station today, today's station. So here about the maternal medicine, you need to assess the they will assess you the all the five domains, as in any station and any module. That is patient safety, information gathering, communication with the patient, communication with the colleagues, and acquired clinical knowledge. And also, you need to understand the in the maternal medicine. Now, today I'm talking about the maternal medicine. What you need to know. It is lengthy station once again. But don't get panicky. People get panicky because it is a maternal medicine. So, what you need to know, you need to understand the what is the etiology of the maternal medicine topic, and also what is a pathophysiology. And here then it also then there are some common conditions, that is where I'll be telling you, like maternal conditions, like from endocrinology they can ask you from about diabetes and thyroid. From respiratory system they can ask from about asthma, and from GIT, inflammatory bowel disease, that includes ulcerative colitis and Crohn's disease. Musculoskeletal system, they will be asking spina bifida. All these are with pregnancy. And connective tissue disorders like systemic lupus erythematosus and Marfan syndrome, and APLA, and that is antiphospholipid antibody syndrome. From cardiovascular system, they can ask hypertension and cardiomyopathies. Hematology, they can ask us sickle cell disease, anemia, thalassemia. And from inherited bleeding disorders, they can ask about the idiopathic thrombocytopenic purpura, and they can ask about von Willebrand's hemophilia A and B. Then from the renal system they can ask chronic renal failure or acute kidney disease and renal transplant. From the central nervous system they can ask epilepsy and headache. And infections in the pregnancy, commonly they will be asking cytomegalovirus, HIV, chickenpox, herpes, syphilis are commonly asked. They are very commonly asked, and sometimes a hepatitis. So you need to know all these conditions. And let me tell you, from the GTG, from the Green Top guidelines, every topic is important. Every topic can come as a simulated patient task, and it can come as a structured discussion also. So you all the GTG topics you have to read it. I mean, get prepared. And this is about the topics which I told you. And so what is important here, that is, maternal medicine starts with the pre-pregnancy care. Sometimes they can ask pre-pregnancy care also for any of these topics. Commonly they will ask diabetes and sickle cell disease. And so what you need to know, the pre-pregnancy care is separate, so you have to prepare separately. And then sometimes they will ask, and with pregnancy and any maternal medicine problem, like in that case you have to know how do you go about. So you have to include antenatal care, intrapartum care, postpartum care, and here you always have to include multidisciplinary care. So always it is a multidisciplinary approach, and there is two-way approach to this management. Coming to the management, there is two-way approach. So you have to say effect of the pregnancy on the condition, and also effect of the condition on the pregnancy. That means pregnancy means it includes mom, mother, and the baby. So with this brief introduction, I will tell you how to proceed. Now, from the symptom point of view, history of present illness, you have to ask. Now, when you read the case scenario, you will know what type of case it is. So related to that case, you have to keep symptoms in your mind. So you have to ask the symptoms related to the medical complication, and also then you have to ask about the present pregnancy. So first is symptoms related to the medical condition. Then in the medical condition, what you are supposed to ask, that is, when was it diagnosed? All these are common in every maternal medicine station. Any maternal medicine station, these are the common things you have to ask. So you can make a template and say the same points in every station. So some symptoms related to the maternal condition. After knowing, you know what is the maternal condition. Diagnosis, when was it diagnosed, what medication she's taking. Sometimes they'll give medication in along with the case scenario also, that she is taking such and such a medication. Then how is the control? So what medication, how is the control, any hospital, anytime hospital she's admitted to the hospital, and how is she regularly visiting the doctor, and when was her last visit, and whether you can review her notes. Always review the notes in every maternal medicine station. You review notes. Now that is about the medical condition. Then pregnancy details. Coming to the pregnancy details, the present pregnancy details you have to say. Ask about the present pregnancy details. Then the previous pregnancy. If she has previous pregnancies, you ask about the previous pregnancy. How was this medical condition in the previous pregnancy? Because all these are chronic conditions. It must have been the previous pregnancy also. Then the previous pregnancy, how was this condition, where how the pregnancy was affected in the previous pregnancy, how was the control of this medical condition in the previous pregnancy, any issue she had. Then how was the delivery, normal delivery or cesarean section, how was the baby at the time of the delivery, after delivery, at the time of delivery, and how was her recovery. Mode of delivery, which I told you, the baby's condition and the mother's condition after the delivery. That is about the previous pregnancies. Then gynec history. About the gynec history, you have to, if it is an early pregnancy, then you take LMP, whether what was her LMP. If you have not asked if you have asked in the present pregnancy, then no need to repeat. But if you have not asked, missed it, take LMP and ask about the cycle regularity, and if she is more than 25 and more, whether she is regular with her cervical screening, any contraception. Then coming to the medical history, whether already she is having some medical condition in a particular station, then whether she is on any other medication, to know whether she has any other coexisting condition. Then allergy, I already told you, allergy is very, very important. Then blood group, you have to always check the blood group, may confirm that also patient safety point of view. And previous surgeries, any previous surgeries she had. And so then family history of whether sometimes inherited disorders, family members can be affected. So family history of similar condition in the family, or family history of diabetes, hypertension, and thromboembolic conditions. Then the partner, if it is an inherited medical disorder, you have to ask about the partner, whether the partner has any type of this type of condition. Then always mental health is important in any antenatal case. Any antenatal case, you have to ask about her mental status. How is she feeling in the previous 8 weeks? Then after the information, this is the information gathering. So it will be the first history of present illness, and the symptom in that it will come, symptoms will come, then history of the information gathering. After the information gathering, what you need to know, you have to tell her about the examination if it is really required. Examination, whenever it is required, you have to take permission. You say, I would like to do the general physical examination, that is nurse will check the blood pressure and pulse rate, and I would like to check your abdomen. Then that is what is if it is required. Investigations, if she has done any investigations, you say that you are going to explain to her the investigations. Now then coming to the then after that, you have to tell her about the condition, her condition, and her pregnancy care. And in that, you have to say the antenatal care, intrapartum care, postpartum care. And then comes the closure of the station. So in this antenatal care, postpartum, intrapartum care, postpartum care, sometimes it will take time. You may not be required to address all these things. So if it is an early, because all the three you need not, you see what is asked, what the task you are supposed to do. If they ask pregnancy care, you stress on the antenatal care and a brief word about the intrapartum and postpartum. But if it is so usually they will be like this, all the three will not be asked, but still depending upon what the task you are supposed to address, you have to know everything about the antenatal care, intrapartum care, postnatal care, postpartum care, and also now then address her concerns, anything before closing the station. You once again confirm whether she has any other concern which is not addressed, and then you have to do the closure. I'll tell you what's the closure. So now with this brief introduction, I would like to say a few points about the patient safety also. So now that the BMI is important. Once again, the BMI and the smoking, alcohol history and all, they're very important in the early pregnancy. But no, mid pregnancy and late pregnancy already, because it is done at the time of booking, so no need to repeat again. Now, her support, family support, everything is important. Now, let me tell you, in the applied clinicology, you have to explain the condition to her. Make a diagram. Here, not much important. Diagram doesn't come much about in the maternal medical conditions, but explain to her the condition. So always that is patient safety point. The communication with the patient. Then always whenever you explain the results to the patient, you have to confirm name, age, and NHS number. The result sometimes in the examination they may keep wrong name. So different name they can keep. Always see what name is there, whether it's same patient or not. Then any medication which is unlicensed, then you have to tell the patient that is unlicensed. And any medication, if you're going to say, talk to her, you say the risk and benefits of each, her side effects of this medication and what are the benefits of this medication, and then and the contraindications, any contraindications are there. These are all patient safety points. And any complications if it is not treated, if the condition is not treated, or what complications the patient is going to have on the pregnancy, that is on her and the baby, and what complications are there with the treatment itself. And consent, suppose she requests any consent, the patient taking consent is very important, informed consent. And then and thromboprophylaxis comes here. In this maternal medicine is very important for the thromboprophylaxis, so we need to give the thromboprophylaxis whenever it is required. So then allergies, rule out allergies. So all these things are important. So with this brief introduction, I would like to start today's case. So today's case is it is a simulated patient task. It is an inherited bleeding disorder. So we have got commonly we have 3 inherited bleeding disorders: hemophilia A, hemophilia B, and von Willebrand's disease. So here we have this is today's case is von Willebrand's disease. This is a simulated patient task. And so you are an ST5 registrar in the antenatal clinic. Antenatal clinic, always this, most of them are antenatal clinics, and then or joint clinics. Sometimes they can be joint clinic. Your next patient is Mrs. Maria John, and she is 30-year-old with type 3 von Willebrand's disease. She is pregnant at 14 weeks. She is here to discuss her pregnancy care. She declined down screening. She is registered at the District General Hospital. Her investigations are given. You always, with the name, age, and NHS number, always confirm. Her full blood count is normal, B positive, no antibodies. And these are all screening, booking blood tests. These are all, remember, these are the booking blood tests. VDRL, HbS Janssen, the viral marker. Then HIV are negative. Midstream urine no growth, and ultrasound scan shows it's a live fetus, and gestation age 14 weeks. So what is the examiner want you to do? Take brief targeted history related to this condition. Targeted is related to this condition, and she will be having concerns because she has a bleeding disorder, and she will be worried. Also answer her concerns and outline the management. Here you have to manage this case, management, antenatal, and because she's a very early pregnancy, mostly cover the antenatal part, and a brief word about the intrapartum, and a word, 1 or 2 words about the postnatal care, because they did not specify about the antenatal management. So they said management. So you have to say this thing. Now, before I start the case, I would like to tell you, they can ask either type 1, type 2, or type 3. Anything they can ask. So you be careful. So here today I am discussing type 3, but type 1, type 2 they can ask. So type 1 and type 2, they are less severe. They are less severe, and but type 3 is more severe, but it is rare. Type 3 is rare, but more severe. And the other thing is, coming to the type 1, that means they can deliver in a standard obstetric unit, and your care will be coordinated with the hematologist, that is hemophilia center. But coming to the type 2 and type 3, that is, we need to refer her to the obstetric hospital, where there are all facilities available to check factor 8 and factor 1 Willebrand factor. So these things you have to remember. So today's case is von Willebrand's disease type 3. Now, how I am going to start this case? Now, with this introduction, now I am starting the station. I told you already it may not be in 10 minutes because I am explaining at the same time, and because I want you to have a broad idea. Then you have to practice, and you can present to my colleague who is Dr. Padma. You can present to her, but you practice and present to her and see that the time limit is 10 minutes. Now, and she'll give the feedback. So now starting the station. Hello, I'm Dr. Manjula. This is the introduction. Hello, I'm Dr. Manjula, one of the doctors in the antenatal clinic. May I confirm your name and age, please? I'm Mrs. Maria John, 30 years doctor. How may I address you? Maria doctor. This is important. Then that is the patient identification. Now agenda. Maria. So she told you to call her as Maria. Maria, I can see that you are pregnant at 14 weeks, and you are here to discuss your pregnancy care plan, isn't it? Yes, doctor. So, and apart from this, I can see that you have a medical condition called von Willebrand's disease type 3, isn't it? Yes, doctor. So, Maria, I'll explain to you about your birth plan and also address all your concerns. And but before that, I would like to gather a few details from you, which helps me in our management plan. Will that be fine? Yes, doctor. So now coming to the now this is about coming. I'm starting about the complaints. So now that you have this condition of von Willebrand's disease, that is type 3. When was it? Can you tell me when was it diagnosed? Take details about the medical problem first, and then go for the present pregnancy. So when was it diagnosed? And so it was, doctor, it was diagnosed when I was around the four, it was, I mean, for, so 14 years, 16 years of age. And because I was having heavy menstrual bleeding, when I went for checkup, so advice, they have done the evaluation workup and they told me that I'm having this condition. So that time they gave me some medications. So I am, which told me to use. So that time it was diagnosed. Then, okay, can you tell me any problem? Are you facing any other problem because of this condition, for like nosebleeds? Anytime you had nosebleed or bleeding from any gums or any cut, bleeding from any cut, or any easily, do you bleed easily from any, if there is any injury? So these are the things which are related to you're asking. And anytime have you noticed any bleeding in the urine, or when it's in the stool? Anytime have you taken, I mean, have you taken any treatment for this, like factor 5 factor replacement, or any time have you taken any blood transfusion? Have you used any tablets, tablets like tranexamic acid, or some injections like desmopressin, or any time were you admitted into the hospital? So these are the questions you have to ask. Anytime were you admitted to the hospital? Are you regularly seeing your doctor? When did you see your doctor last? Can I see your notes? With your permission, can I see your notes? So these are the common things which you are asking in every maternal medicine topic. Now, so this is about the condition, her condition. You want to know how is the status, present status. Now, coming to the pregnancy. So, okay, coming to the present pregnancy. So, Maria, can you tell me about this present pregnancy? Is it your first pregnancy? She'll say yes or no. First pregnancy means, then you say, is it your plan pregnancy? About the, if it is first pregnancy, no need to ask about the previous pregnancy. Is it a planned pregnancy? Now, I see from your notes that you are 14 weeks of pregnancy. And can you say whether your previous cycles were regular? And so then I could see that your booking blood reports are attached here, and the scan report also, which I'm going to discuss in a while. Have you done your dating scan? And if she says yes, doctor, I have done, then was it corresponding to the dates? Usually dating scan will be done much earlier, 8 to 7 to 9 weeks. So that time it will be done. Now she's 14 weeks. You have to ask about the dating scan, whether it's corresponding. Now, so that is about the booking blood test and dating scan. She has done the booking blood test and then also scan. It is 14 weeks. Now, I see that you have declined down screening, and when you did the scan, can you tell me the reason for declining? Because you would like to know what's the reason. So, no, I don't want to do it, doctor. So, in that case, you cannot force her. You say, okay, it is your choice and we respect it. But if you like to decide you want to get it done later, we can always arrange it at 15 weeks also. So, and it is let me tell you, it is an important scan. Maria, it is an important scan where we detect some genetic abnormalities like Down syndrome. but you can rethink about it. Okay. Now, coming to now this is over. History is over about the medical condition in the present pregnancy. If suppose she has previous pregnancies, suppose this is second or third pregnancy, now ask about the previous pregnancy. Can you tell me about the previous pregnancies? And how was this condition? Did you face any problem during pregnancy because of the medical condition? Did you face any problem during pregnancy? What type of, how was the mode of delivery? Whether it was a normal delivery or a cesarean section? And then how was the condition, and at what gestation age you should ask? When was it done? Was it before dates or at the time date given to you? That's a term pregnancy. Then how was the baby at the time of delivery? And how was your recovery? Can I see your notes? There also you have to see the delivery notes. So two notes you have to see: medical condition notes and delivery notes. Now coming to the gynec history. Yeah, already if you have asked regular cycles you will ask only in early pregnancy. Don't you want to repeat? But if you have not asked, just you say regular cycles or not, to know whether the dates are corresponding to the scan. Then and also, are you regular with your cervical screening? Yes. So this is one thing you have to ask. Cervical screening, I told you, you have to always see the age and then ask. So now, coming to the medical history, next is medical. Are you on any other medication? So then any allergies? Do you have any allergies? I could see that from your report that you are B positive. And if, let me, can I, I would like to ask, if need arises, would you accept blood and any blood products? Because you want to rule out Jehovah's Witness, which is very important. Suppose she says, no, doctor, I don't want to accept any blood. I'm a Jehovah's Witness. Then you say, do you have any advance directive? Because that is very important if Jehovah's Witness. Now, coming to the past, have you undergone any surgical, any operations on the tummy? Any operations have you undergone? And suppose cesarean section, she had cesarean section before, other than cesarean section. Then, coming to the family history, any family history of similar condition? The similar condition, that is von Willebrand's, or any other bleeding disorder? Have they been tested? Have they been tested, your family members? Okay, now coming to the social history. Coming to the social history, you have to ask, do you smoke or take alcohol? Or pardon me for asking, do you take any drugs for drugs? And then she will say yes or no. If she says yes, smoking and alcohol, drugs, then you have to address that. Say, if suppose she smokes, quantity, alcohol or drugs, quantity you have to take alcohol also. Then if she says smoking alcohol, you say it is not good for your pregnancy and your health. So both the mother and the baby. So if you permit, I would refer you to the NHS Smoking Cessation Center program, where they will help you to quit the smoking. Alcohol also, not heavy, and drugs also, de-addiction. You can refer to the particular center. Then coming to the BMI, if she is there, it is written in the case scenario. You say, I see that your BMI is so and so and so. But if it's not given, you ask, can you tell me your BMI? That is either you can say BMI or height weight ratio, because it is important. And then if it is high BMI, if the BMI is higher side, so then you say, BMI, I see that your BMI is high, and it can cause some issues for the pregnancy. So for then can I, if you permit, I will connect you to the diet and exercise program. Then and there you address. Now coming to the what do you do for living? You want to know what is whether she is working. In that case, because you have to give her sick leave, and how is the support at home? And are you down or depressed due to any reason? Do you feel low, or down or depressed in the past few weeks, 4 weeks? Then coming to the partner testing, always in all inherited disorders, you have to ask the partner testing, which is important. If it is not tested, you have to send him for testing. Now, he is normal, doctor. She says normal. Then fine. If she says no, not tested, then we would refer him to for the genetic counseling. So then the history is over now. All the histories you have taken. Would you like to add anything? Yeah, no, doctor. So now you say, if you permit, then I will ask my nurse to check your blood pressure and your pulse rate. That's all, because you don't have to examine her. She came here to with the scan report, so no need to examine her. Just tell her that my nurse will check the blood pressure, pulse rate, and see now, Maria. I have your scan report and the booking blood test. So I confirmed your name, age, and the NHS number. The booking tests are all normal, and the scan report shows that the baby is doing fine and you are at 14 weeks. Now, always address the investigations. Now, coming to the medical problem, you have to address the medical problem. Then pregnancy. Now, coming to the medical problem, do you have any idea about what this von Willebrand disease is? No, no or yes, she will say whatever she says. So you just explain to her, see, Maria, you have this one Willebrand's condition disease, which is type 3, and it is an inherited, brief description about it. It is an inherited condition. That means you get it from one parent, you get it from your parent, and then will pass it on to your child. So because there are three types, type 1, 2, 3. Type 1 and 2 require only one faulty gene to affect the baby. And so the baby has 1 in 2 chances of getting it, and it is less severe. Then in type 3, if it requires 2 genes from both the parents, and it is rare and severe type also. So now we need to know whether the baby is affected or not, which is very important. So we can do by 2 ways, like either we can test your blood, check your blood for that is called as cell-free fetal DNA, to see whether the baby is affected or not, or after the baby is born, the baby's blood will be tested. So this way we can see the baby's blood, and she may ask you, why doctor, what is the problem if I have this condition, whether my pregnancy will be having any issues. So then you say, no, the pregnancy, because of some issues can come, like there is a specific protein called this during bleeding. What happens normally, let me tell you, normally cells come together to form a clot, and this von Willebrand factor, this forms a glue, and that's called adhesive protein, so to this clot, so the bleeding will be stopped. But in this condition, when the factor is absent or very low, that is absent in type 3, it can cause some issues to mom and baby. Can I tell you what can happen? Yes, doctor. So always take the permission. For mom, they can be bleeding during pregnancy and also after delivery. Sometimes needing blood transfusion also. For the baby, it can inherit the condition, it can get this condition, or sometimes baby can have the bleeding on the skin and the brain. So shall I explain about the pregnancy care now? Yes, doctor. So now coming to the antenatal care. Your pregnancy is considered as high risk, and it is under the concentrated care under a team of doctors. That is called multidisciplinary team of doctors, where our consultant, the blood doctor, that is a hematologist, the anesthesia doctor, the lab doctor, the baby doctor, and all are will be involved. So you need to come frequent visits, and also we will check the blood for your blood flow, this factor, von Willebrand factor, at booking in the third trimester, that is the last 3 months, and also before delivery, and after delivery also we need to check this factor. And also whenever we plan any procedure, we need to check, because our aim is to keep this level more than 0.5 international units per ml. If it is, let me tell you what happens. If it is less than 0.5, if it is less than 0.5, then we need to give you some medication like injections, like desmopressin. And also when we give this injection, we will tell you to limit your fluids intake for 1 liter per 24 hours. This is patient safety, as it causes then if there is no response to this injection, so we can give the concentrate, the factor, this von Willebrand factor concentrate. And sometimes we can give some medications also, that is like tranexamic acid, along with this we can give some tablets also. So now coming to the scan, Maria, let me tell you, you need frequent scans. So if you rethink and decide for a scan to get it done to know down screening, we will refer you to the fetal medicine unit, where they will do a needle test, scan and needle test, to know whether your baby is normal or not. Then that is whether their baby is having abnormal and genetic problem. Then at the mid-pregnancy, we do a 20-week scan, that is around 20 weeks. We do a test to rule out congenital defects, and also we'll do the baby's growth from 28 weeks, because baby's growth also we need to see. Now at 36 weeks, anesthesia doctor will see you and give you pain relief options. They will, if the factor is less than 0.5, if it is low, they will avoid giving injection to the back, that is epidural pain relief to the bum, that is epidural analgesia. And the mode of delivery also will be discussed by the at the 36 weeks by your consultant. You can have your normal vaginal delivery. We can wait for you to set into labor. Now, during delivery, what we do, it will be hospital delivery, Maria, and both my baby will be monitored during labor, and also baby doctor will be present at the time of delivery. We will avoid some instruments when delivering the baby. We will avoid. We don't put you any scalp electrode to the baby's scalp, and we will avoid injections. And also, if it is bottom down, we will not do any moving the baby to bring the head down. And also, after delivery of the baby, we will see that the baby's bleeding is not too much, and we will take measures. So if you bleed a lot, we will give you some medication. So this way we will manage your delivery, and we'll see that it is atraumatic as possible. Am I clear? Now, coming to the yes, doctor. Coming to the after delivery, your baby's blood will be checked for the factor, whether to know whether baby is affected or not. We will give you some vitamin K, but not injection, orally. And also we will do a scan to see whether baby has any problem, that is any bleeding inside the brain. It can happen sometimes. And for the mother, we will encourage breastfeeding, and also we will check the von Willebrand factor, and we will give the tablet called tranexamic acid for 7 to 14 days to if the bleeding, to keep the factor more than 0.5 if it is a normal delivery for 3 days, and for if it is a cesarean, we will see that it is maintained for 5 days. We will avoid some medication like ibuprofen, diclofenac, that is NSAIDs, and you may require sometimes treatment with the factor. And then coming to the sometimes blood thinners may be required. That will be decided. And then contraception at the time of discharge, we can advise you contraception. There is no contraindication, Maria. So now you need to have follow up with the hematologist. So am I clear so far, Maria? Any other concern? No, doctor, it's clear. Now I am documenting whatever we have discussed. This is the information leaflet about the condition, what we have discussed. I'll connect you to the support group. I'll give an appointment with our consultant. And also, if you are willing, I'll give an appointment for the scan. To get a scan and down screening, I'll give an appointment with the fetal medicine unit. And also, I'll give you an appointment with the hematologist because he need to see you. So, and I'll give you the 24-hour contact number. Anytime you feel any problem, then you can always come to the emergency. So, so now this way we will manage your pregnancy and also your medical condition and about the pregnancy care plan. So, thank you for your time, Maria.